Hello friends, welcome to channel Thinkpedia, and this is a parent education modules by Thinkpedia. In this video we shall discuss about certain frequently asked questions by parents about asthma in children. Do have a look. Question number 1. What is asthma? So asthma is a condition that can make it hard to breathe. Asthma does not always cause symptoms, but when a person with asthma has an attack or a flare-up, it can be very scary. Asthma attacks happen when the airways in the lung becomes narrow and inflamed. Asthma can run in families. Question number 2. What are the symptoms of asthma? Asthma symptoms can include wheezing or noisy breathing, coughing often at night or early in the morning or when you exercise, a tight feeling in the chest, trouble breathing, etc. Symptoms can happen each day, each week, or less often. Symptoms can range from mild to severe. Although rare, an episode of asthma can lead to death. Question number 3. Is there a test for asthma? Yes, your doctor might have a child do a breathing test to see how his or her lungs are working. Most children 6 years old and older can do this test. This test is useful, but it is often normal in children with asthma if they have no symptoms at the time of the test. Your doctor will also do an exam and ask questions such as what symptoms does your child have, how often does he or she have the symptoms, do the symptoms wake him or her up at night, do the symptoms keep your child from playing or going to school, do certain things make symptoms worse like having cold or exercising, do certain things make symptoms better like medicine or resting. How is asthma treated then? Asthma is treated with different types of medicines. The medicines can be inhalers, liquids, or pills. Your doctor will prescribe medicine based on your child's age and his or her symptoms. Asthma medicine works in one of the two ways. Number 1 is quick relief medicines. Stop symptoms quickly. This medicine should only be used once in a while. If your child regularly needs these medicines more than twice a week, tell his or her doctor. You should also call your child's doctor if this medicine is used for an asthma attack and symptoms come back quickly or do not get better. Some children get hyperactive and have trouble staying still after taking this medicine. Long-term controller medicines control asthma and prevent future symptoms. If your child has frequent symptoms or several severe episodes in a year, he or she might need to take these each day. Almost all children with asthma use an inhaler with a device called spacer. Some children need a machine called a nebulizer to breathe in their medicine. The spacer and nebulizer both help get more medicine into your child's lung when it is needed. A doctor or nurse will show you the right way to use these. It is very important that you give your child all the medicines the doctor prescribes. You might worry about giving a child a lot of medicines, but leaving your child's asthma untreated has much bigger risk than any risks the medicines might have. Asthma that is not treated with the right medicines can prevent child from doing normal activities such as playing sports. They can make children miss school and damage their lungs. What is asthma action plan? An asthma action plan is a list of instructions that tell you what medicines your child should use at home each day, what warning symptoms to watch for, what other medicines to give your child if the symptoms get worse, and when to get help or call for an ambulance or your doctor. You, your child, and your doctor will work together to make an asthma action plan for your child. As part of the action plan, your child might need to use a device called peak flow meter. This device is used at home to see how well your child's lungs are working. Your doctor will show you and your child the right way to use a peak flow meter. Should my child see a doctor? See a doctor or if your child has an asthma attack and the symptoms do not improve or get worse after using a quick relief medicines. If the symptoms are severe, call for an ambulance. Can asthma symptoms be prevented? Yes, You can help prevent your child's asthma symptoms by giving your child the daily medicines the doctor prescribes. You can also keep your child away from the things that cause or make the symptoms worse. Doctors call these triggers. If you know what your child's triggers are, you can try to avoid them. If you don't know what they are, your doctor can help figure it out. Some common triggers include getting sick with the cold or the flu, allergens such as dust mites, moles, fur animals, including of cats and dogs, and pollen from the trees, grasses, and weeds. Cigarette smoke, exercise, change in weather, perfumes, deodorant, scents, cold air, hot and humid air. If you can't avoid certain triggers, talk with your doctor about what you can do. For example, exercise can be good for children with asthma, but your child might need to take an extra dose of his or her quick relief inhalers before exercising. And last question, what will my child's life be like? Most children with asthma are able to live normal lives. You can help manage your child's asthma by making changes in your life to avoid your child's triggers, keeping track of your child's asthma, following the action plan, telling your doctor when your child's symptoms change. Sometimes asthma gets better as children get older. They might not have asthma symptom when they become adult, but other children can still have asthma when they grow up. Thank you friends for watching this video and do subscribe to channel Thinkpedia. Thank you very much.